First case is a 46-year-old female who has about a 1 to 2 month history of vague symptoms, including trouble with her vision, some visual blurring. Sometimes she says she loses vision temporarily. She's noticed some numbness and tingling in her arms and hands, and her balance has been off a little bit. And there's been no associated trauma. She hasn't had any recent weight loss or other illnesses, just the symptoms that I noted over the past 1 to 2 months. So the patient had an MRI of her brain done, which showed a region of what we call signal abnormality. It just looks a little different than normal on an MRI, and it's unclear what that was. So as the surgeon, you're being asked to biopsy her brain. Would you proceed with a biopsy at this point to make a diagnosis? The answer is I would not proceed with a brain biopsy at this point. The patient's clinical presentation and age is most consistent with multiple sclerosis, potentially. We did have a neurologist see her. She underwent a full workup for multiple sclerosis, including a spinal tap, which did confirm the diagnosis. For those of you that did proceed with the brain biopsy, an artery was injured during surgery, which led to bleeding in the brain. This required further emergency brain surgery to try to remove the blood clot and save the patient's life. The patient's life was saved, but she did incur a large stroke, which was permanent.